Atos have seen the way the political wind is blowing from both Labour and Conservatives and think that's what they've got to do. But whether it's something like that, whether it's simply corners being cut because the process has been done too quickly, whatever the answer is, the fact is that the process isn't working and that genuinely vulnerable people have been denied money as a result.
Mr. Alexander told me how he'd asked to see a copy of the contract, but the sections he really wanted to see, those relating to how the company is paid, were not provided. The company wouldn't show me either, but I did find a doctor who was willing to tell me a bit about the culture within the firm. She'd assessed incapacity claims for Atos. She doesn't want to be identified for fear of a backlash, but she claims she felt pressure to rush assessments and keep down the numbers of people she assessed as unfit to work.
Apart from the idea that you were really asked to perform in terms of average time per assessment, medical management pointed out that the figure for the number of people getting through, that is, being told you're not fit to work, was on the high side, and the national average should be this particular figure.
So you say that you were actually taken aside and questioned about your statistics. What was the impression that you got from management about that, in terms of what was expected of you?
That I was too soft, that my assessments were too soft, that I was letting too many through.
Were you made to feel that you were certifying too many people as unfit for work?
Yes, there was no doubt that I was made to feel that I was on the soft side with my assessments.
So how important were these national averages or targets when it came to your appraisals or your performance?
Incredibly, it was never about how you're settling in, are you getting enough tea breaks? It was always, you're a bit on the slow side, your figures are a bit high, and can you explain this?
We wanted to interview Atos about these issues, and we also asked to see the unseen parts of the contract, but it declined and instead provided this statement.
Atos Healthcare is continually monitored and audited by the Department for Work and Pensions to ensure that it completes the highest standard of assessment and that medical advice is correct. Atos Healthcare and its employees are not advised of the result of the assessment, and the outcome has no bearing on Atos Healthcare targets or remuneration.
Testing ESA claimants is not Atos' only job. It also does staff medical assessments for the civil service. And I've come across a case which suggests that an Atos medical conclusion about a patient can differ markedly depending on who the client is. Vicky Bell is 34. She was a benefits advisor for the Department for Work and Pensions, and she has ME.
You just can't move, you just feel exhausted. When you lie in your bed, you feel your body just sinking into your bed, just from sheer exhaustion.
Growing up, Vicky was a normal, healthy girl. She was just out of her teens when her symptoms began. Over the years, she learned to manage her condition around her job, but eventually it became too much, and she was left bedridden.
My intention was to get back to work. I needed to work. Things just didn't work out that way. They were looking for me to give them a date to go back to work, and I couldn't honestly give them a date because I knew myself I wasn't fit.
Vicky was called for a staff medical, and the Atos worker concluded,
Miss Bell has an underlying medical condition and there's currently no indication that she's fit to return to work.
The job centre where she'd worked for 15 years dismissed her on health grounds. Just 3 weeks after being told by Atos she was too ill to work, events took an ironic twist. She was sent for another medical, again with Atos, but this time for ESA, and she scored 0 points.
Very little of the report reflected what was said at all at the interview. They should know, they should have experience of the illnesses that they're assessing, which I don't think they did.
So your employers, the DWP, used Atos to certify you too ill to work and that you would not be able to return to work within the foreseeable future. Then 3 weeks later used Atos again, who certified you absolutely fit for work and that you weren't entitled to the higher rate of benefits.
Yeah. I wasn't entitled to benefit at all.
Vicky couldn't understand how on one hand Atos said she was too ill for her desk job, Yet on the other, she was told she was perfectly fit to work and her benefits were cut. We asked Atos about this. It said that these were two different types of assessment with different objectives and criteria. The point of ESA was to get more people back into employment. But is it just pushing people off one benefit and onto another? Up to 45% of the people who applied for ESA dropped out of the process. And the DWP admitted to me that it doesn't know what happens to them.
The failure at the moment is that we can't actually see what's happening to them. That there's no tracking of them within JSA, so we can't see whether they're moving into work or staying on benefits. We don't know where they are in terms of any kind of services or support services. But as important, in a sense, nor do the people who are supposed to be working with them. Yeah? So that the people who are supposed to be helping JSA people back to work don't know what kind of medical problems they may or may not have. They don't know about what kind of medical support and condition management might be appropriate. In a sense, there's no joining up between the ESA side of the system and the JSA system. They're two systems and they're not talking to each other at the moment.
The new coalition government last week signalled its intention to press ahead with a planned rollout of ESA and put the existing 2.5 million incapacity benefit claimants through the new medical. The huge number involved, though, has led to concern that if this does go ahead, this system could go into meltdown.
Citizens Advice Scotland has carried out a comprehensive examination of ESA's first 18 months in operation. It has given the BBC exclusive access to its report, which is due for publication tomorrow. Its conclusion? Unfit for purpose.
The charity has called for the rollout to be shelved, pending an urgent independent review.
I think the DWP and government needs to listen to the recommendations that we've suggested in our report and talk to us about how they can implement that to create a better atmosphere, a better environment for people going through the ESA process. We have huge concerns about the rollout. Obviously, if the issues that we've faced over the past 18 months of ESA aren't ironed out, we're going to see 2.5 million people go through the same process, suffer the same types of problems and same types of issues that we've faced for the past 18 months.
Danny Alexander was equally concerned about the rollout. Just 44 days before his promotion to the Cabinet, he was extremely critical of a government department his new coalition was about to inherit.
There must be a very serious concern about whether the rollout is appropriate, because there are millions of people who are currently on incapacity benefit who are going to have to go through this new assessment. If the experience we've had over the last few months, certainly as I've seen it in my own constituency is anything to go by, then there will be thousands, tens of thousands, maybe hundreds of thousands of incorrect decisions that are made. Tens of thousands of appeals will follow. And that will be a system that then is close to meltdown. If there's a failure going on here, and I think there clearly is a failure going on here, it is ministers who should be taking the rap for it, and it's ministers who should be changing the way the system works to ensure that it is fair.
A minister himself now, Mr Alexander has assured the BBC that he remains concerned about ESA and will continue to raise the issue. We wanted an interview with someone from the Department for Work and Pensions, but it refused. Instead, it gave us this statement.
People need much more support to manage their conditions and get help to find work, and moving them to ESA is the best way to do that. We will continue to work with organisations like Citizens Advice and Macmillan to make sure their concerns are addressed.
Too late, of course, for June Mitchell. Employment Support Allowance was designed to help weed out those playing the system. But the people we've spoken to believe they were the ones who've been cheated. Since giving this interview, Vicky Bell reapplied for ESA. This time, she scored 21 points and will now get the support she needs to get back into employment. David McNeish is no longer claiming ESA and is working part-time as a gardener.
Basically, I feel that I've got better in spite of the benefit system and not because of it.